Hi, this is Madan Kumar. I'm one of the OET trainers working with AIM Academy. Today, I'm here to discuss writing module in detail so that students can achieve B grade. So, let's get started. So, let's see what are the contents of today's video. First, we shall see the explanation of the question. Then we do have the planning, how to plan the introduction. Then we do have the paragraph planning, and then possible ways of organizing a letter. Then we do have a sample letter. So let's begin with understanding the question. Here is the question. When we talk about the question, it is always good to go with understanding of a few things first, which includes understanding and knowing who is the writer, who is the reader, and what is the purpose. Usually the writer information should be there in the start of the question, but not always, and at the same time the reader information should be there in the last of the question. Here we shall see who is the writer, which is given in the start of the question. You are the charge nurse in the medical ward at Queen's Hospital. Mr. Dean Irwin is a patient in your care. So we got to know the writer is the charge nurse, and we shall find out who is the reader. That should be there in the last, as I said. And writing task. Using the information given in the case note, write a letter to update Miss Lynn Hunt, nurse in charge, St. John's Nursing Home, 29 Marubra, who takes care of him, outline relevant information and anticipated needs following his return home tomorrow. So here they have very clearly given that patient, it's a letter to update, and so it feels like the patient is known to the reader. So let's go back and find out whether is this really an update, in the sense we are updating to the person who already know the patient or not. And the way to find out that is by knowing the address of the patient. Here it is given that St. John's Nursing Home, 29 Street, Jones, Marubra, and this is same as the reader address, in the sense our reader works in a nursing home where patient resides. So let's understand the whole story now. Patient details: name of the patient Dean Irwin, date of birth 11/6/67. Social background says he's a widower. Next of kin details: poor adherence to diabetic diet and diabetic management. Poor adherence to diabetic diet and management. This is kind of medical background, medical thing which is given under the background of social, but which is one of the possibilities. It can happen sometimes in the OET. Medical background states type 2 diabetes, diabetic neuropathy, current medication metformin, atorvastatin, ramipril, and novorapid. And there is a date 10/7/2020, presented with pain, redness, swelling on the left foot. Assessment says warm to touch, hindfoot valgus with mid-foot break. So I suppose these warm to touch and hindfoot valgus with a mid-foot break, that should be in the left foot, because basically patient presented with left foot problems, in the sense all the problems which are noted or which are there, that is in the left foot. So I suppose all these specific findings are from the left foot as well. And medical management record states MRI confirmed left Charcot foot. So patient underwent MRI which confirmed the Charcot foot. Here we do not know what is Charcot foot, so but still it is fine, because there is no problem over if you do not have that particular knowledge of disease condition, still we will be able to write a good letter. For your reference, I'm just letting you know Charcot foot, in the sense it is just a neurological disorder where the sensation of that particular foot will be lost because of neurological damage, and it can be a complication of diabetic neuropathy, where this patient has neuropathy, but here as it is not connected, in the sense Charcot foot is a complication of diabetic neuropathy, in this question particularly will not connect like that, but it can be a possibilities. So okay, let's go and find out what else. Doctor suggested surgical management but patient denied. Advised to wear air-cast boot for 10 weeks and to use crutches. Rest and offloading of the left foot. Patient educated regarding importance of taking insulin on time and balanced meals. Injection Panadion Fort 500 mg stat. Blood investigation states creatinine 84, blood sugar 8.4, and HbA1c 109 mmol. Discharge plan, and this is the only thing which we did in the hospital, and now the patient is all ready for discharge, and the discharge is tomorrow. Review after 6 weeks. Blood sugar monitoring thrice daily. Monitor patient compliance with diabetes management. Encourage food care. Inspect feet daily to look for signs of foot attack, which includes new redness, swelling, pain, and smell. Contact podiatry team in case of emergency. So there are few things which have to be done by the reader. So altogether we can call them as continuing care or ongoing care, but I think continuing care is most preferable word here. So now we do know that the writer is the charge nurse, reader is nurse in charge, and this is a noun case, and we actually have to update the recent information and to request for continuing care. Continuing care is equal to blood sugar monitoring, monitoring patient complaints, encouraging food care, and inspecting the feet daily for signs of foot attack, and to contact the podiatry team in case of emergency. And here there is one more very important thing which I have to tell you is about noun case. What do we actually mean by noun case? Most often people say that noun case in the sense the reader should know or would know everything about the patient. I mean, background, what are the medications the patient is on, and social background. Yeah, it may be one of the possibilities. The reader would know all of the background details of the patient, but sometimes it is not exactly same, because either the same nurse in charge, she must be the in charge for many people, many wards, and maybe for the whole hospital sometimes, and even so she may not know everything personally, so she can access to data which should be available in the nursing home. So when we think of a noun case, it is better to consider that the reader could access to data patient, rather considering that she knows about the patient. So there are two different things. She knows in the sense they would memorize everything about the patient, but that may not be a possibility, and that is the same thing with GP, because GP might have many patients, maybe in thousands, and it's not a possibility to know particularly what is the background of each patient, what is the social background of each patient. So but they will have files, they will have the details. If they want to, then they can always look into what is the condition, what we have treated before, things like that. So when there is a noun case, then better to consider that as the reader could access to all the information of the patient, rather considering or rather thinking that reader is completely knows everything about the patient. So this is about the understanding of the question. Now we hopefully have gone through everything and we did understand. So let's go to the next part, that is planning the introduction. Okay, now we'll see the introduction planning. Here we have, first thing we discussed the question. First we should know who is the writer, that is the charge nurse. Then to whom we are writing a letter to, that is nurse in charge, she is the reader. Then what is the purpose? Here requesting continuing care, and specifically here we have written that it is requesting for continuing care, rather writing update, because there are few things which has to be done by the reader. That is why we have given the name continuing care, rather just stating that this is just an update. But we can use the word update in the introduction for sure. And then we do have problems, which is diabetic neuropathy and Charcot foot. Here diabetic mellitus is not added, only because when we say diabetic neuropathy, then we do know that patient has diabetes, and Charcot foot, of course, this is newly diagnosed, and so that we have added this. And again here patient condition could be added, like diabetic mellitus could also be added here. So what are we trying to do here in particularly is we are trying to find out what is the actual reason we are writing a letter. Here, along with updating, we are actually requesting for continuing care. But why we are requesting for continuing care? That is because of this condition. Patient has diabetic neuropathy, and recently patient has been diagnosed with Charcot foot, and that is the reason we are requesting for continuing care from the reader. So, and this is all for Mr. Dean Irwin. So this is what we have to know before getting into it, and all the time we have to question ourselves. We are the charge nurse writing to the nurse in charge, but why? There should be a question mark. Then we will come to know why. That is the purpose, requesting continuing care, and why you have to request for the continuing care. Then we will come to know there is a patient condition. In other words, you can call it as purpose, problem, and the patient name, which has to be included in the introduction, or in other words, what is required from the reader, why it is required, and to whom this information could be added in the introduction, and that gives the clarity for the reader what to be done and why it to be done and to whom. So let's go to the next point, that is the expansion of purpose. In the sense, I used the word continuing care before, so what does it actually mean by continuing care in this particular case? Because continuing care is a general word, or it can be kind of abstract word which doesn't have a specific meaning. We are not discussing about the definition of the continuing care here, but we, in this particular case, what is the continuing care? For that, I think we have seen those things in the discharge plan. So those things includes monitoring compliance with diabetic management. This is one of the continuing care which we require, patient requires from the reader. Then blood sugar monitoring thrice daily, that is one of the continuing care we require, and encouraging the food care and inspecting the food attack, inspecting the food for food attack. These few things has to be done by the reader, and this is called continuing care in this particular case. Again, we are not discussing the definition of continuing care, rather we are thinking what is the continuing care we have to request from the reader for this particular patient. This is what it is. So we just have to know all these things before we start writing a letter. And next, the thing is how to plan the paragraphs. First, in order to plan the paragraphs, first we should know what is the way, or what is the series of information which is given in the case note. So let's say they have given the personal information first, and for this you have to keep going with the question. Then they have given the social history and the medical history, presenting complaints, medical management, and discharge plan. Here the discharge plan usually in the sense what to be done after the discharge, so or else what is the request you have to you have for the reader. So basically that discharge plan could be called as in other words it could be called as recommendations, but make sure that few times discharge plan B could include many other stuffs as well. And presenting complaints and medical management, these things have been done in the hospitalization, or this could be called as hospitalization details. And this naming is for the just to keep things easier and to organize the letter properly. We just named it, but you can go without this planning as well, without writing hospitalization details, without writing the recommendation. Still you will be able to write a good letter. This is for just our comfort. Then we'll arrange the series of information as per the requirement of the reader. See, there is a information given in the task, but we need to arrange in some way for the reader. So that is what it is. And of course we should start writing a letter with the personal information, because that is the best thing and that is always nice. And anyway, we are going to add this personal information a bit in the reference as well as the introduction, and maybe of course we should start with the personal information again in the paragraph. But if I say personal information, it doesn't mean that everything to be added, just maybe just a name is enough, or else simply that could be called as personal information. And then medical history. The reason why I would start with medical history here is because patient is a noun case of type 2 diabetes and diabetic neuropathy. Sometimes people think it is a noun case, so why would we write about medical background or medical history to the reader? But here the problem is we are all talking about the problems which are actually associated with diabetes, and the whole charcoal food which is newly diagnosed, which could be one of the possibilities that it can be a complication of diabetes or diabetic neuropathy. And another thing, we do have some recommendations which are related to diabetes. So again, it is good to start with that, and that's the reason why I would write medical history in the first or second paragraph. Then about the hospitalization details. And remember, this is not the paragraph, this is the series of information. And if the hospitalization details could be, there are a lot many information which we have to write in the hospitalization details. Simply I would split this into 2 paragraphs. Then there is a social history and recommendations, but here very importantly social history, there is nothing much social history given in the question first of all. And another thing, the social history could be avoided because there is nothing very important about social background which the reader has to know, and there is nothing much it would imply on the recommendation part. So basically I would leave this part. And if at all, if any social background is kind of making any implications on the recommendations or any ways it helps for something in the whole case note, then I would actually add that, even if it is for the noun case. And sometimes if it is completely irrelevant, then we can take it out, and I consider social data is completely irrelevant here. But in the question we do remember that under the social background there was one thing, poor adherence to medical diabetic management. That is under the social background, but still that is one of the important matter, and that is one of the important information which we have to include in the case note. And the last would be recommendations, and this is the series of information which we have to present in our letter. So first is personal information, then we write about the medical background just to give a background idea to the reader, then we tell what has happened during the hospitalization completely, then we go for recommendations so that reader would understand what is required to be done now to the patient. So let's go and see the discharge plan, and this is one of the important aspects where we always miss, because when we say discharge plan there are 2 aspects which are really important to know. Discharge plan could be the plan which we have during the hospital stay to discharge the patient, in the sense what do we have to do to discharge the patient from the hospital. That could be called discharge plan, but not always. And again, what is the plan for the patient after patient discharge from the hospital? That also could be discharge plan. In the sense, discharge plan in simple terms could be 2 things. What do we do to discharge the patient? That could be discharge plan. And what we have to do after the discharge, that could also be discharge plan. But here and what do we have to do to discharge the patient, that work is actually for the writer. And what is the plan for the patient after discharge, that usually for the reader. So this is just a very important thing, because we have to know discharge plan. It doesn't mean that everything has to be done by the reader. No, there is nothing like that. In the real life settings, what to be done to discharge the patient is also called discharge plan. And here we do have few things which are very clearly to be done by the reader. That is, we can group them together under the heading of request. What do we have to request? And here, inspecting for the food attack, encouraging the food care, blood sugar monitoring, and monitoring compliance with the management. So these 4 things we clearly have to request the reader. But there are few things which just have to be informed, that is regarding the review as well as contacting the podiatry. And this is just, we are helping, or we are just letting the reader know, because they should know, but they have nothing to do with all these things. So just we have to be very careful what is request and what is information. And here this differentiation is only to write nicely, in the sense we can group these 4 things first so that it looks very nice for the reader and it's just easy to understand, and we can group them together at the end of the recommendation paragraph so that it looks quite easier for the reader to understand what do we have to do to the patient. Then we do have the next thing, that is the possible way of organizing. Next is possible way of organizing paragraphs. Here we do have the particular data should be there under the 1 paragraph, and I'm clearly letting you all know this is not the only way to write a letter. We can always rearrange the paragraphs, we can always write the data in different places, and still we can make a B grade writing. Here we have tried 1 or 2 methods just to let you know there is always a possibilities. So you can choose whichever the way you want and whichever the organization you would like. And but just make sure that there is a flow and there is the proper connection between the paragraphs. So here we started with the paragraph 1, in that we have started with DM and neuropathy, and then we have admission details. In the sense, here this is the medical background, then we are going for the hospitalization details, that is admission details, then what we found in the assessment, then finally what is the diagnosis. Here there is a one very important aspect of paragraphing, in the sense every paragraph should have one central idea or one core idea. Here what is the core idea is just background with hospitalization details. Here the hospitalization details is not completed, but still we have stopped it when the diagnosis is done. So this gives a clarity to the reader. Okay, the patient has diabetic mellitus and neuropathy and admitted with so and so problems. We found his foot was quite warm and hind-foot valgus with mid-foot break. Then we did a MRI during hospitalization which confirmed Charcot foot. So we can stop it here. Then there is a continuation of the hospitalization details, which includes the patient denied surgery. Then there was advice given to use cast boot and to use the crutches. Rest and offloading was suggested, and the blood reports states this, and the education regarding food and insulin was given. And here again, before writing education, we can even write one of the data which we found in the social background of the question, which is poor compliance with diabetic management, and that data could be here before writing education. And then the paragraph 3, here, it is completely dedicated for the recommendation, which includes monitoring compliance with diabetic management, blood glucose monitoring thrice daily, encouraging food care, and inspecting for food attack. And we do have to write the signs of food attack, and contact podiatry team in case of emergency, and to review after 6 weeks. So this is a very simple information which we have included almost all the data here, and only the social data is taken out, and it seems to be well organized. And as I told you, this is not only the way, we can always write in another ways as well. So here we have the admission details, then admission details, the problem with pain and swelling on the left foot. Then we do have the assessment, then we do have the diagnosis. So this itself could be one paragraph, which the paragraph could be about admission details only. And then the second paragraph could be all about the hospitalization details. Then paragraph 3 could be about the background of diabetic mellitus and diabetic neuropathy, and education, and about the blood reports. Then fourth paragraph is again dedicated for recommendations or suggestions, which has to be done by the reader. Here, the most commonly people always ask whether should we actually write diabetic mellitus and neuropathy as this is the noun case. As I have already explained this, it is better to write this because we do have the recommendations related to diabetic mellitus, and also we have given education regarding diabetic management during our hospitalization stay. So it is better, I would recommend you to write that, just because the recommendations are related to diabetic mellitus, and there is nothing wrong in saying that in our letter. So this is the possible 2 ways of organizing a letter. You can go through it again, and if there is another way, you can possibly find it out which suits better, then you can always go through it. And it is just for the practice session we have organized into 2 ways. So now let's see a sample letter, final version of all this planning and stuff. So here we do have a date 10 July 2020 because patient was admitted on this date, and we do know that patient is going to be discharged on 11 July 2020. That information was given there in the question. And then we do have the clear information about the reader and the reader address. Dear nurse, here even you can write dear Miss Lynn Hunt. Then reference Mr. Dean Irwin, the date of birth, and we have tried to keep the same date format everywhere just for the clarity purpose. Then here the very important thing is people always ask us is shall we write that introduction, shall we write can we write like this and all. So here we have tried 3 different introduction, and Possibly that is the way we always practice, because that is a part of time management as well, and it gives an idea which introduction suits really well for the particular question. Here, let's go with the introduction first. Mr. Irwin, who has been treated for diabetic neuropathy and Charcot foot, requires continuing care from your service. Here we have used has been treated for diabetic neuropathy and Charcot foot, and we haven't mentioned about diabetic mellitus. You can mention if you really want to, and sometimes even you can take it out diabetic neuropathy and you can use only Charcot foot. But here, as there are a few recommendations about diabetic neuropathy and we have given advice about diabetic management during hospitalization, I would add that information in the introduction. Then Mr. Irwin, who has been treated for diabetic neuropathy and Charcot foot, requires continuing care from your service. He will be discharged back to your facility tomorrow. Here, discharge back to your facility. This will it will make sure that the patient is known to the reader. Again, introduction 2. I'm writing this letter to update regarding Mr. Irwin, who has been treated for diabetic neuropathy and Charcot foot. Here again, the word update will make sure the reader understands this is update, so that this should be hours. And he requires continuing care from your service following his discharge tomorrow. And third introduction is the purpose of this letter is to request continuing care for Mr. Irwin, who has been treated for diabetic neuropathy and Charcot foot. He will return to your service tomorrow. Here, return to your service will make sure or will carry the meaning that this is the noun case. Here we have tried 3 introductions, but 3 introductions you can see that have started differently, and this is just for the practice. We are trying to start the same introduction in 3 different ways, still able to carry the same meaning, and still we are giving a hint that the patient is known to the reader. So you can always try the same methods, and you can always go with, and another 3 things which I already told in the introduction planning, that patient name, patient condition, and the purpose. Here Mr. Irwin is the patient name, and the diabetic neuropathy and Charcot foot is the patient condition, requires continuing care. It is the purpose of writing letter, and these 3 things are always there in the introduction. And another reason why we haven't added about diabetic mellitus here is, when I say diabetic neuropathy, in the sense it is kind of understandable that patient is diabetic, so that is the reason why patient has diabetic neuropathy. So we haven't included that diabetes in here. So let's go to the first paragraph. I have started with, as you know, Mr. Irwin has a type 2 diabetes. Again, as you know is something which is just to let the reader know this is your known case. Mr. Irwin has had type 2 diabetes and he was admitted to hospital today with the complaints of pain, redness, swelling on the left foot. Of course, this information could be, reader would always know about it, but still we are just make sure we are just adding that just for the clarity. On assessment, his left foot was warmer and he was found to have hindfoot valgus with mid break. Again, sometimes people ask the same question. This all information could be known to the reader. Why would we actually add this information in the writing? But it is in all the Western countries, any break in the skin integrity is one of the main concerns. Here the patient has mid-foot break. It is actually the very important matter for the reader as well as for the hospital. They should know what was the condition while the patient came in and what is the condition when the patient went off. So for that reason we have added that very particularly. An MRI was performed which confirmed diagnosis, which is the Charcot foot, and this whole paragraph is written as per the first way of organization which we have showed. So here we have added the background first, that is type 2 diabetes and diabetic neuropathy. Then we have written the admission details and it is quite in detail. Then we have written the assessment, then we have written about the diagnosis. So it includes the background information, admission details and the diagnosis. That is the central idea or core point of this paragraph. Then about during hospitalization, Mr. Irwin denied surgical management. He has been advised to wear air cast boot 10 weeks and to use crutches. In addition, adequate rest and offloading of the left foot have been suggested. His blood investigation revealed creatinine 84, blood sugar level 8.4, and HbA1c 109 mmol. He has been educated regarding the importance of taking insulin on time and balanced diet. If you look into this, the hospitalization details which is given in the question, which these all things are done in the hospitalization or during the hospitalization or during the hospital stay. So we have added all together in one paragraph, and maybe if you write this in a letter or in your book, it can look quite bigger. So if that is this thing, then you can split this into two paragraphs if you want to, but as far as I'm concerned, it gives the clarity that what all the things happened during the hospitalization for me. So I'm really happy with one paragraph having complete details of hospitalization stay. Given the above details, you are requested to monitor Mr. Irwin's blood sugar thrice daily. Kindly monitor his compliance with diabetes management. Please encourage food care and inspect his food daily to look for signs of food attack, such as new redness, swelling, pain, and smell. In case of emergency, contact podiatry team. So here this is completely dedicated for the recommendations which has to be done by the reader. And we have used the very simple sentences, as well as we have clearly written every point in one sentences, just to keep it very simple and understandable to the reader. And at the end, please note he has a follow-up appointment after 6 weeks. If you have any queries, do not hesitate to contact me. That is just in conclusion, you are sincerely, charge nurse. So here we have very clearly written the paragraphs which are quite easy to understand, which are quite straightforward as well. I think if you could follow this method, it's quite easy to get the B grade, and also to manage the time as well as to manage the word limit. Please let us know what you feel about the video on the comment section, and please don't forget to like, share and subscribe to our channel. Thank you.